Hello, I'm Dr. Mugdharao, the clinical reproductive immunologist and a gynecologist at ICPRN, that is Dr. Raut's Center for Reproductive Immunology. Happy World IVF Day. Today is a day to celebrate one of the greatest achievements in modern medicine. IVF has transformed reproductive health care and has helped millions of couples around the world become parents. As someone who works closely with IVF specialists across the country, I have immense respect for IVF and for the science behind it. But today I'd like to talk about another group of patients. Patients who have done everything right. They have good quality embryos, their uterus appears normal, their hormones are optimized, their IVF has been performed very well. Yet pregnancy still doesn't happen. When that happens, the first question is usually, should we do another IVF cycle? But perhaps that isn't the first question we should be asking. Perhaps the first question should be, why didn't this IVF cycle succeed? Because every unsuccessful IVF cycle tells us something. The challenge is learning to listen. The first question we need to challenge is a belief that almost everyone has. A good embryo guarantees success. One of the most common misconceptions is that once you have a good embryo, pregnancy is almost guaranteed. Unfortunately, biology is more complex. A healthy embryo is essential, but implantation is not something the embryo does alone. Implantation is a conversation between the embryo and the mother's body. The embryo may be ready, the uterus may appear perfect, yet implantation may still fail. Why? Because successful implantation depends on far more than embryo quality. It depends on hormones, endometrial receptivity, blood flow, genetic factors, and in selected patients, the immune system. A failed embryo transfer does not automatically mean the embryo was the problem. Sometimes the real question is, was everything required for implantation actually evaluated? And that naturally leads to the next questions, which patients often tell me, Doctor, everything or all my reports are normal. That sounds reassuring, but it doesn't necessarily mean that every possible cause has been investigated. Routine fertility evaluation examines ovulation, fallopian tubes, uterus, semen analysis, hormones, embryo quality. These are extremely important investigations, but they don't answer every question about implantation. In selected patients with repeated implantation failure or recurrent pregnancy loss, additional evaluation may be appropriate. Sometimes the next answer isn't in repeating the same investigations, it's in asking a different question. Routine investigations answer many questions, but they don't answer every question. Here, I would like you to think about this. If all reports are normal, what else could explain repeated failure? Yes, routine investigations answer many questions, but they don't answer every question. So the obvious question becomes, if routine investigations don't explain repeated failure, what else should we be looking for? This is the most important question before another IVF. Instead of asking, when can I start the next cycle? I encourage couples to ask something different. Do we understand why the previous cycle failed? Every unsuccessful IVF cycle provides information. If we don't learn from that information, we simply repeat the same uncertainty. Sometimes the explanation lies in the embryo, sometimes in the uterus, sometimes in genetics, sometimes in endocrine factors, sometimes in thrombophilia, and sometimes the answer lies within the immune system. The goal is never to perform more IVF. The goal is to perform better IVF. IVF that is guided by understanding rather than assumption. Among all these factors, there is one that has received increasing scientific attention over the past 2 decades: the maternal immune response to pregnancy. So, the question asked is, can the immune system affect pregnancy? This is probably the most often asked question, and the answer is yes. But it's important to understand what that actually means. The immune system isn't good or it isn't bad. Its job is protection. But pregnancy asks the immune system to perform something extraordinary. It must continue protecting the mother while simultaneously accepting a different, unique embryo. That is one of nature's greatest biological balancing acts. And for most women, this happens naturally. But for a carefully selected group of patients with recurrent reproductive failure, that balance may not function optimally. This is why reproductive immunology has become an important area of research and clinical practice. Not because every patient has an immune problem, but because some do. And those patients deserve to be identified. Immune protection in pregnancy means immune tolerance or acceptance, which leads to implantation and continuation of pregnancy. Now, one more question which everyone must think today, that we've never heard of reproductive immunology. But once we understand that immune factors may contribute in carefully selected patients, the next logical question is, can anything be done? So, now where does Immulate fit? Once we identify carefully selected patients whose reproductive failure may have an immune component, the next question becomes, how do we restore that balance? At our center, every patient undergoes individualized evaluation. Not every patient requires immune treatment, and not every patient is suitable for Immulate. Patient selection is just as important as the treatment itself. When appropriate, one of the treatment options we use is Immulate, which is our patented immunotherapy protocol developed after years of work in reproductive immunology. Treatment should always follow diagnosis, never the other way around. And that brings me to what I believe is the biggest mistake we make after a failed IVF cycle. The biggest mistake after failed IVF, the biggest mistake isn't that IVF failed. The biggest mistake is assuming every IVF failure has the same cause. One patient may need a different embryo strategy, another a uterine intervention, another genetic counseling, and another immune evaluation. There is no single answer, only individualized medicine, and that is where modern fertility care is heading. So, after how many failed IVF cycles do you think we should stop repeating treatment and start asking deeper questions? There isn't one magic number. But when good quality embryos repeatedly fail to implant, or pregnancy repeatedly ends in miscarriage despite appropriate treatment, that is the time to pause, to think, to investigate whether another IVF cycle, because it's always not the next solution. Sometimes understanding why the previous cycle failed is the most important treatment of all. I would like to end this session with one message, which I would like to give every couple and every fertility specialist to remember this World IVF Day. And it is this: IVF remains one of the greatest achievements in modern medicine. It has transformed millions of lives, but science continues to evolve. Our responsibility is not simply to repeat treatment. Our responsibility is to understand biology better so that treatment becomes increasingly personalized. So, before asking when is my next IVF, ask why didn't my last IVF succeed? Because sometimes the next breakthrough doesn't come from another cycle, it comes from asking a better question. Thank you for joining me, and I again wish you all a very meaningful and a happy World IVF Day.